When you talk to your doctor, you share things you might not tell anyone else on the planet. It's this unique space built completely on trust. But what's really holding that trust together? Well, today we're going to pull back the curtain on medical confidentiality, that invisible shield that's supposed to be guarding our most sensitive information.
It really all comes down to this one question, doesn't it? Is your most private information actually safe with your doctor? We all just kind of assume the answer is a simple yes, but the truth is, well, it's a whole lot more complicated. It's this incredible web of ethics, laws, and some pretty heavy responsibilities. So let's dive in and find out what's really happening behind that clinic door.
Pretty much everything in healthcare, it starts right here, with this pact. It's this unspoken promise that lets you be vulnerable, that lets you share what's really going on, so your doctor can actually help you. Take away that trust, and honestly, the whole system just grinds to a halt.
I mean, think about it for a second. If you were worried that what you said might get out, would you be totally honest about everything? Probably not, right? It's that trust, that feeling of safety, that makes it possible for us to share the critical details they need to give us the right diagnosis and the best treatment.
Okay, so here's something we need to get straight, because these two words get thrown around all the time: privacy and confidentiality. They're related, but they're not the same thing. The easiest way to think about it is like this. Privacy is your right to build a fence around your personal life. You decide how high it is and who gets a key to the gate. Confidentiality, on the other hand, is your doctor's professional duty to stand guard at that gate and never, ever open it for anyone unless you say it's okay. So it's your right versus their responsibility.
So that protective shield we were talking about, what's it actually made of? Well, it's forged from two really powerful things: a set of deep ethical promises and some serious legal muscle. Let's look at the ethical heart of it first.
At its core, your doctor is making you 4 huge promises. First, they respect your autonomy, which is just a fancy way of saying it's your story, you're in control. Second is beneficence. They keep things secret because it's for your own good. Third, and this is a big one, non-maleficence, a vow to do no harm, and that absolutely includes the harm that could come from your info getting out. And finally, justice, making sure these rules apply to every single patient equally. No exceptions.
And these aren't just some nice ideas or friendly suggestions. We're talking about the full force of the law here. Huge legal frameworks like HIPAA over in the US and GDPR in Europe take these ethical promises and bake them right into legal code. They lay out the blueprint and, more importantly, the penalties for not following the rules.
But, and there's always a but, isn't there? That shield, it isn't totally unbreakable. There are these very rare, very specific situations where the law actually forces a healthcare provider to break confidentiality. And that's where things get really complicated. Now, these exceptions are never, ever taken lightly. They exist for huge public safety reasons, like, say, needing to report a dangerous disease outbreak to stop it from spreading. Or, when a judge issues a court order. But the one that really tests the limits of ethics is that last one, the duty to warn.
Just imagine this scenario for a second. A psychiatrist is in a session, and their patient doesn't just say they're angry, they lay out a credible, detailed plan to go out and seriously hurt a specific person. Suddenly, that psychiatrist is stuck between a rock and a hard place, caught between their duty to their patient and their duty to protect a potential victim.
I mean, what do you do? Seriously. The entire therapeutic relationship is built on that promise of secrecy. But there's a life potentially hanging in the balance. It is, without a doubt, one of the toughest calls a healthcare professional could ever have to make.
And that right there is the perfect example of this incredible ethical tightrope walk. In these very specific cases, when the danger is clear, immediate, and aimed at an identifiable person, the law often says that public safety comes first. The duty to warn can actually punch a hole right through that shield of confidentiality, forcing the provider to warn the person in danger or the police. It's a crack in the shield, but it's a crack that's designed to stop a much bigger catastrophe.
Now, the challenges aren't just these intense ethical dilemmas. The whole game has changed. I mean, it used to be that the biggest risk was somebody misplacing a single paper folder. A big deal for one person, sure. But today, the risk is a massive cyber attack on a hospital's entire digital record system. We're talking about millions of patient records being stolen all at once. The scale is just mind-boggling.
So, with all these modern threats, you might be asking, how on earth do we even begin to reinforce that shield? Well, the good news is healthcare systems have gotten pretty sophisticated about it. They've developed a really structured, multi-layered defense to protect our data.
Think of it like building a fortress. You don't just build one wall. You build 3,
each one designed to stop a different kind of threat. These layers cover the people, the technology, and the actual physical spaces, all working together to create one seriously tough defense.
So what does this actually look like in the real world? Well, an administrative safeguard is the hospital having a rock-solid policy about who can look at your file, and then training their staff on it over and over again. Technical safeguards are all the digital locks and alarms, things like encryption that scrambles your data into unreadable code, or requiring complex passwords. And physical safeguards are exactly what they sound like: the actual deadbolt on the door to the records room, or the super secure 24/7 monitored data centers where the servers live.
So the system has all these heavy responsibilities, for sure. But here's the thing. This isn't a one-way street. Protecting privacy is actually a shared mission, and that includes the hospitals, the doctors, and you. Everyone has a part to play.
For the big healthcare institutions, it's not enough to just have a rule book sitting on a shelf. They have to actively build a culture where protecting privacy is second nature. It has to be baked into everything they do, from day one of a new employee's training to doing regular audits to hunt for weak spots.
But here's the most crucial point, the real takeaway. At the end of the day, it's your information. You have rights. You have the right to see what's in your file, to ask for corrections if something's wrong, and to find out who's been looking at it. Being an active partner in your own healthcare also means being an active guardian of your own data.
And that leaves us with one last big thought to chew on. We're living in a world of shared data, where things like AI are starting to analyze our health information on a massive scale to find new cures. As that happens, the very idea of what privacy even means is changing right before our eyes. The conversation about where we draw the line between medical progress and personal privacy is more urgent than it has ever been. So what does that line look like for you?